Okay.
Hey, man, can you talk about PTSD,
Sure.
the causes, the online assessments, and where in the hell I can find a properly trained therapist to treat my moderately severe PTSD?
Yes.
Most therapists jump on this or that and never properly diagnose it. It's not that hard to diagnose, but impossible to treat without a diagnosis. And I would like to find some help.
Yeah.
And I don't think most therapists are that well trained on it.
Yeah.
Thanks. Have a good one. Bye.
Well, I think I had PTSD myself, so I understand this, and I empathize.
I've got it too.
Yeah. Mm-hmm. Yeah. So you have two people here who are empathetic to your problem.
Exactly.
And
it's terrible.
It is terrible. And it's caused from exposure to real or threatened serious injury, or it could be sexual assault, anything like that. They arise from complex interactions inside your brain. So there's all these different scripts that are firing just constantly. And studies have found that, there are changes in the brain. Hippocampus, the anterior cingulate, all these different little places in the brain have altered function in people who have PTSD. So it's not bullshit. It's real. Symptoms would include rumination, where people constantly think about the event or things surrounding the event or things like the event.
Yes.
So you have these intrusive thoughts. We talked about that last show with Jim Norton about memory loss. So these people sometimes will experience what they feel is memory loss, and what it is their short-term scratch pad memory keeps getting erased by these thoughts that intrude regarding the traumatic event or events. They could have nightmares, persistent involuntary memories, which really kind of feeds into that intrusive rumination thing. Flashbacks, and then emotional and psychological reactions to either triggers or just in general. They just can be very emotional and have these sort of outbursts. And then they'll try to avoid anything that's a trigger. And sometimes if the trigger is environmental, you end up avoiding everything. And you end up being agoraphobic. Mm-hmm. So you end up in the house.
And it can happen. I mean, mine happened because we were in that really bad rainstorm and I couldn't see to drive.
Yeah.
And now driving in the rain terrifies me. So anything can
And
cause
I remember
it.
that it was scary AF. I think we went through a tornado, actually, on a mountain road with cliff on one side. And everything just went black all of a sudden. But I do think that your PTSD probably stems from some deeper, earlier stuff, too. And
Probably.
that just, gave you something to hook on to, Mm-hmm. But you really have to be diagnosed by someone that knows what the F they're doing. So they're going to look for causation, and that they're going to look that that you're consistently re-experiencing the event or events, and that you're doing avoidance. So, Tacey, you can speak to that. You avoided driving in the rain.
Watch the weather like you wouldn't believe.
Yep.
Just
and then
worried about it.
And negative alterations in cognition, which goes back to the memory thing, and mood. And so, you could have persistent negative emotional states, things like that. And then hyperarousal, where you're just vigilant. Is this thing going to happen? Tacey was checking the weather just obsessively anytime that she knew that she had to drive. So, some people have PTSD that's related to way more traumatic events. But when you have it, it doesn't matter to you how traumatic the event was. The symptoms are the same. So what I would do in a situation like that, and what I did do in my situation, which goes back much farther back, is seek counseling from someone that is a cognitive behavioral therapist. And if they advertise that they, treat PTSD, try one of those. But you want cognitive behavioral therapy, because it's quicker. It's not Freudian. You're not lying on the couch talking about your mother for 8 hours. You are basically doing therapy that helps to change the internal scripts in your brain. And it can be quick, sometimes 6 weeks. For me, 15 years. But, I had some deep-seated shit going on. But therapy with a cognitive behavioral therapist, to me, always feels very kind of concrete, that you're solving problems and you're moving forward. So, anyway, that's what I would do. What do you think?
What do you think about medication?
Yeah, absolutely. The thing is, your eventual goal wants to be to go back to normal without medication.
Exactly.
Not everybody can do that, but that should be a goal. Mm-hmm. If your symptoms are so severe that you can't work or interact with people in a positive way, then you need to seek help. And then those are the people that, if it's so extreme that medication could help get things calmed down so that their body can understand that these reactions aren't going to kill them. Once you kind of, particularly if this manifests as panic attacks, if you continue to expose yourself to those triggers rather than avoiding them, eventually your body realizes you're not going to die, and the power of that reaction is diminished, and you start to get better. I'm not going to say that my anxiety is completely gone, but I was disabled when it happened. Mm-hmm. And I had zero quality of life. But the one thing, I don't see myself as being a particularly strong person, but I never allowed it to stop me from going to work or going to things that my friends wanted to go to, even though I was so unbelievably uncomfortable at those places.
Yeah.
I just wanted to scream at everybody. You're not safe. You're not, you're treading on the footsteps where murderers have treaded, and, just crazy stuff. But and then with counseling and continually exposing myself to those triggers that made me very uncomfortable, it went away. I've told you the story about the day that I got better. Mm-hmm. And I don't know if I've told the story to this audience, but my problem was being in crowds, and the triggering incident doesn't matter, but it was, my life was basically being threatened. And so that bubble of safety was gone. I didn't, that illusion that we have that we're safe and we're going to live forever was completely diminished. And so I had trouble being in crowds. I didn't like being in public, but I forced myself, like I said, to do stuff. And one of the things that I really liked was, and I still do like, is fireworks. And the last night of the North Carolina State Fair in Raleigh, North Carolina, I knew that they hadn't fired off the fireworks for the last 3 nights because it rained. So they were going to fire all of them at once. I'm like, I'm not going to miss that. So I went, and with I can't remember if it was, yeah, she was my wife at the time, with my wife at the time, and she knew about my problem. And after they shot off all the fireworks at once, it was the most amazing finale I've ever seen. And then when we went out, it was 10,000 people all trying to go out of one door. And I was going, oh, shit. And so we were shoulder to shoulder, chest to back, just crammed like sardines, not moving, because, when you've got all these people trying to go out of the door of one gate, it was a big gate, it's going to take forever. And she looked at me and she said, "Are you okay?" And I said, "I'm going to have to be," because I didn't have any choice at that moment. Mm-hmm. I either had to die or just get better, because this was the most extreme trigger that I could have had, was being in this giant crowd of God knows who. And after that, it started getting better. Mm-hmm. I mean, I could tell. From that day, it didn't just disappear, but it started to decline. And the more that it declined, the faster it declined, because I realized it didn't have any power over me anymore. So you can get better. And I want you to get better and get help from someone that knows what they're doing, and that's going to be a cognitive behavioral therapist that advertises PTSD.